And we're back here on this Saturday morning. Steve Kashul, Dr. Brian Cole at Sports Medicine Weekly. Time now for our Ask the Doctor segment. It gives our listeners the opportunity to have Dr. Cole address their specific sports injury issues. Very easy to ask us a question. Go to our website, sportsmedicineweekly.com. On the homepage, you're going to find a picture of Dr. Cole and yours truly. Click on that link, and you can submit your question. Dr. Cole, first question, what suggestions do you have for returning to the health club?
So, Steve, as states are opening up, and specifically, for example, Illinois opening up, health clubs as of yesterday or Friday were allowed to do so. And I think there's certain things that are still in place, which means the numbers of individuals are going to still be limited. That's part of this next phase, and that's the responsible thing because that's called physical distancing or giving the opportunity to physically distance. Some health clubs will probably check temperatures. I would advise everyone to strongly consider checking their temperature on a daily basis as we start to open up. Proper hygiene, as we know that contact surfaces can be a source of contamination. Wearing a mask while you're working out, especially and not grunting or the kinds of things you sometimes see in these muscle gyms, that's got to be eliminated. So minimizing sort of respiratory secretions and so forth. Everyone has their own towel and wipes things down. Those are the kinds of things you would do. So the same things that we're kind of doing now, which is wearing a mask to prevent contamination from me to you and you to me. Physical distancing, which is 6 feet apart or more. If you're wearing a mask and you're for short periods of time next to someone, that's okay. We just say no prolonged periods of time. Making sure all the equipment is wiped down after you use it. Certainly being respectful of others. I think in that setting, it's fine to go to a health club. These are all calculated risks, and all the things that I'm talking about are things that can indeed reduce the chance of disease transmission.
We've got time for one more, Dr. Cole, and this is a really good question as well. I've heard this. Dr. Cole, I'm hearing that some professional athletes are saying they would like to contract the virus because they think once they get it, it'll be out of their system and once they're well. Do you subscribe to that theory?
Well, I mean, in an ideal world, it would be nice if the fewest number of people got it until we got the vaccine. What that listener is implying is that I would like to get it. I'm pretty confident I don't have any, medical comorbidities or problems that put me at risk. I'll hope for the best, and then I'll be immune. And that logic is, in part what some countries in Europe were doing. They were saying, let's just let everyone get sick who's going to get sick. Once we get to 60 or 70%, nobody else is going to get sick because we'll have what's called herd immunity. This particular individual is saying probably not looking for societal benefit, but saying, look, I'm tired of living this way, and unfortunately, this is how people are thinking. Let me just get it so it's one and done. But, there's that X factor that you don't know who the 21-year-old is going to be, for example, who's going to get sick. And young people have died with this virus. So, everyone's going to have a different value system. And there are people who are getting impatient. This is wearing thin. And they're wearing thin. And I understand that. People are just human. And this is just an unprecedented list of forces on all of us. I would argue that it's probably best not to get it if you can avoid it. And if the cost of not getting it now, once we open up, is simply try to physically distance, don't touch your face, keep your hands clean, wear a mask, because even if you get it, it isn't for sure that you can't get it again. And there's some suggestion that can in fact happen. And we don't know how long immunity lasts once you get the virus. So there's too many unknowns, at least, and again, this is a matter of opinion, to say let's just go out and deliberately get it. I'm not sure that is a logical conclusion, quite frankly.
Well put, Dr. Cole. We're out of time. My best to you and your family. Have a great rest of the weekend, and please stay healthy.
Likewise, Steve. Have a great rest of your weekend.
Many thanks to our producer, Shane Reardon. Also want to thank David Cole for managing our website and our business operations, as well as Samantha Smith from Midwest Orthopedics at Rush. For Dr. Brian Cole, I'm Steve Kashul. We say so long, and thank you for listening to Sports Medicine Weekly. We'll be back again next Saturday at 8 a.m. Central with a brand new edition of Sports Medicine Weekly, only on 670 The Score. Have a great rest of your Saturday, everyone, and please stay healthy.